Greetings from Public Health Dayton in Montgomery County. My name is Fabrice Juin, and I am the project manager for the local Office on Minority Health. Welcome to this recording of the For the Culture Real Talk with Kinfolk on COVID-19 podcast, where you can expect an open, honest, intimate, and intentional conversation on COVID-19 and how it has and continues to impact the Black and African American community here in Montgomery County. This discussion will be guilt-free, shame-free, and non-scripted, with the purpose of demystifying the noise around COVID-19 and vaccination, as well as empowering our folks to not just seek out the truth, but to act on the truth to help make sure that our Black brothers, sisters, and kinfolk are not left behind as we work to pull ourselves out of this crisis. Our special guest for this session is Dr. Alonzo Patterson. Alonzo Patterson III is in his 30th year serving children and families of the greater Dayton area as a general pediatrician. A graduate of Wilbur Wright High School, Wright State University, and the University of Cincinnati, he returned to Dayton after completing residency at Nationwide Children's Hospital. Since returning, he has served on several health-related committees, participated in various community and professional organizations, and served on numerous boards of trustees. He has taught medical students in 3 decades, and for 3 decades, has also received multiple teaching and medical awards, in addition to being named a top 10 African-American male right here in this community by Parity Inc. So Dr. Patterson, thank you again for joining us. And I just want to check in. Am I leaving anything out of that bio, sir?
No, that's more than generous enough. I appreciate it.
Sounds good. Sounds good. So we will jump right in with, just jumping into this discussion and conversation. It's still very strange for me, I have to admit, to recognize that we've been going through this COVID-19 pandemic crisis for close to 2 years now. When I think about what things were like at the end of 2019 and where we're at now, it almost feels like looking at 2 different societies, right? And obviously not for the better. So I want to ask you, as a medical professional, how has your day-to-day changed during this COVID-19 crisis, from pre-COVID to the present?
Well, Fabrice, I appreciate that question and the opportunity to share with you today. As a medical professional, a lot has changed in our day-to-day operations and how we go about things. Some of it has been pretty stressful. A lot of healthcare professionals are really feeling the brunt of needing to kind of suit up every day. The need for PPE isn't just when you hear about a new variant. We've been wearing masks for the last 2 years. We've been wearing face protection and eye protection for the past 2 years. We've had a lot of people due to quarantines or illnesses missing from the staff. So we have staff that are overworked and stressed out. We have parents and patients who have needs that didn't exist before. There's far more testing going on. There's far more needs for notes about being quarantined, being absent, and it's been a lot different. I think that when you look at day-to-day operations before, they were a lot simpler, and it's added a degree of complications. For instance, the way our practice operates, we have very few seats in the lobby now for patients to come in, just to prevent crowding in the lobby. And all of our patients for the last 2 years who have been ill pull up to the back parking lot of our building, call, and then we meet them at the back door and bring them in and bring them directly to a room, so that we cut down on how much people are passing each other in the hallways, and then we take them back out the back door. That might seem like a small thing, but that's a extra work for 10, 15, maybe 20 patients a day for some offices that didn't happen for office staff. So there's been a lot to change in healthcare delivery, and to be honest, it's really stressing out the system. We hear about overcrowding in hospitals, but physician offices are really seeing the strain as well through things like that.
And thank you for mentioning that. I think people don't really consider the operations piece, right? Because when you talk about having less staff, and having maybe less people to go out into the community, and you talk about the changes in how clinics or medical spaces operate, who suffers from that, right? Who suffers from not being reached by certain services, and who suffers from having an even longer line or wait line to get a certain service or to see your physician? It's the people that probably did not have more than half an hour to come by and stop by for this appointment, or the people that don't have that transportation and need those services to come to them. So that operations piece is something that I don't think has been shown, is that yes, there are definitely people who are going to suffer in terms of their healthcare and what they're able to access, because of how we've had to change our operations or change our way of work due to COVID-19. So that brings us into the next question about what was your practice like when the pandemic first began to really climb during the summer and winter of 2020, from the physical and mental state of your clients and patients to even the overall workload. How was the crisis mode experience like for you and even your team?
Well, my practice during the early days of the pandemic, our changes happened in March of 2020. Things really changed a lot for us. And when the schools got shut down and everything kind of got shut down, our office got shut down. We changed our practice so that we only saw well patients in the morning and sick patients in the afternoon. Oftentimes there was not a whole lot of well patients to be seen because nobody wanted to go to the doctor's office. And when you look at those sick patients, a lot of them also didn't want to come to the doctor. There's a lot of people who put off care for things because not just in my practice in pediatrics, but on the family practice side of things, because they didn't want to take the chance of going to the doctor's office. We shut down actually during the busiest time of the year for pediatricians, is when all the school-age kids are sick. We lost somewhere between half and to 25 to 50% of our practice during that time. It continued into the summer and through the fall as we tried to figure out how do we deliver care that people need, and it continued through that entire year. When we look at 2020, overall, pediatricians all across the country had to really figure out a new way of delivering care, and it caused people to get behind in vaccinations, routine vaccinations. It caused people to not follow up for their asthma as often as they should, or other chronic conditions. So practices really changed and had to adapt some. Some things we were able to shift to telemedicine and telehealth, but it's not always easy to do what we do through the telephone. When you need to look at a rash carefully, and I'm trying to get people to take the kid to the window and have the light come in the window a different way. Nobody has lights in their house like I have in one of my rooms. I have 4 fluorescent bulbs in a 10 by 12 room. Nobody has that much light in their room. So to be able to really see things and touch things and talk to people in a way that we can connect became very difficult. And it continues to be different in how we do things, like I described earlier.
Thank you for sharing. I mean, I could just speak on my end. Working in public health, I can definitely say the fatigue has been real. To go 2 straight years where 80 to 90% of your time is dedicated to the same problem, while the other longstanding issues have not gone away, right? Truly an impossible circumstance. And I can't even imagine what it's been like for medical personnel who are actually treating these hospitalizations, which have fluctuated but have never really truly gone away. But something happened towards the end of 2020 that at least gave me a lot of hope. And that's what I want to ask about next. As the COVID-19 vaccines were being developed and being prepared for use, what was going through your mind about what this would mean for this pandemic crisis and the community you serve?
Well, being a pediatrician, I've made use of vaccines all of my career to help prevent illness and death from different bacteria and different viruses. So, my hope was that an effective vaccine could be developed that would provide that hope, provide that reassurance that there is something we can do to prevent illness and death from this particular virus. And I saw the vaccine as that. There's been vaccines developed during my career that I have seen made a big difference in the lives of children, which also means a big difference in the lives of families. And this virus was one that was affecting several different layers of the family. As we know, people who were getting the sickest first in this illness was our elderly. And many times in the patients I take care of, those elderly are the ones taking care of the children, if not as a primary caregiver, as a frequent caregiver. I could think back to my early days when I was younger. I lived right upstairs from grandma. Grandma was the one, taking care of me. She was the one who taught at the Head Start that I went to. So to see those types of people impacted by this disease, really struck home for me. And I knew that as people had hardship with, job loss and the impact that has on us fiscally, a lot of times those elderly were the ones who did own their own, and now families was moving back in. So we had to do something to keep family members from inadvertently causing a very valuable part of our families and a very valuable resource for our families from getting sick. And so vaccination to me offered some of that hope. If we can keep more people from getting the illness itself, we keep people from sharing it. We keep people from sharing it, those most vulnerable won't get as sick from it. And so vaccination was a way of doing that. Because, this is certainly a different disease than chickenpox. I'm not comparing this to something that usually goes away in a week or so, but it still had the same impact in that when people get infected with chickenpox or used to get infected with chickenpox, they couldn't go to school for a week. They had to stay home. Their caregivers had to stay home with them. So if that happens for 2 and 3 and 4 people in the house, then that's 2 or 3 or 4 or 5 weeks that somebody's not going to work, that somebody's not doing the day-to-day activities that kind of make life worthwhile. So we had to find something to change that, and I saw vaccine as that thing that could help change that. The degree of illness that this virus has caused has been tremendous. The degree of hardship it has caused goes far beyond the measure of the numbers of deaths and hospitalizations. And those impacts are going to be felt for years to come.
Absolutely. And because when you talk about somebody passing away, right, that's one individual that might have been the foundation of a household, right? That might have been the breadwinner, or somebody that has supported so many others. So definitely understanding that we're not just talking about individual numbers and losses, that this is community-wide impact, no matter what amount we're seeing. So Dr. Patterson, would you say that a mental shift occurred for you when the COVID-19 vaccines finally became available, late 2020 and early 2021, as we saw vaccine hesitancy in action?
Yes and no. I think that I always talk with people who have some hesitancy about vaccines. Even the routine vaccines we give in children, there's some hesitancy about some of those vaccines. And so talking about vaccines and reassuring folks about the safety and the efficacy, or how well they work, and help them point out the things that how the benefits far outweigh the risk, is something that I've always done. So I anticipated the vaccine hesitancy and understand it. I think that a lot of times the medical professionals try to, at least we're perceived as downplaying people's concerns and not validating what it is that they are concerned about. And I try hard not to do that. I want them to understand that there's, again, real reasons why I'm talking about this. You know, you mentioned losing those resources in families. So far in the United States, there's been about 180,000 children who have lost a primary caregiver. You know, that's more than the city of Dayton has in population. So you take a whole city and fill it full of orphans. And the definition of an orphan is someone who loses a primary caregiver, not just someone who is parentless. But that's significant, and that's a significant trauma in a child's life, and something that they're not going to make go away. So, you know, I keep that in the back of my mind as I talk through hesitancy. But I knew it was a big hill to climb when it comes to new vaccines, because again, I've seen new vaccines come out. You know, an example again is the chickenpox vaccine. People didn't think it was worth preventing. In the 25 years or so that we've been given it, I can tell you there's a whole lot of parents who are happy that they don't have to miss work when each of their 3 or 4 children have the infection happen. So, you know, I was kind of prepared to see some hesitancy and knew it would happen, and with good reason when you talk about the Black community. I think that the disparities that exist and have existed for some time, the atrocities that have happened throughout the history of life for people of color here in the United States, it's real. It's not imagined, and it's not something made up. You know, we're not saying we're afraid of the boogeyman. We're afraid of some real stuff that has happened in this country.
Absolutely. So you're validating, you know, the experiences while still also making sure that the urgency of the situation is well known. That's a fine line, right? That's a fine line that is not always easy to balance, but it must be, because you got to make sure you're not turning folks away and how you approach them. At the same time, we got to talk facts, we have to talk numbers, and we have to talk about the here and now, about what's going on in this nation related to COVID-19. So as a doctor, and knowing that these vaccines are truly our greatest weapon in ending this crisis, what has it been like to see the delay in our folks getting vaccinated? I know you mentioned, you know, that there was some anticipated hesitancy, which makes sense for sure. But even, you know, as we're talking about, you know, the beginning of this new year, 2022, you know, what has that been like for you to see that this continued delay and our folks catching up to, you know, the rest?
I think that the you know, for me, it's a missed opportunity. It's a missed chance to be more aggressive at taking more control over our medical destiny. I think that historically in this country, we've had to wait for things to kind of trickle down to us. We had to wait for things to kind of get to where we were. We had to go further to get it and wait longer to have it. And this was an opportunity where we could have participated a little faster in controlling our own kind of healthcare destiny a little bit more. And some people, you know, don't see it that way. Don't see this as necessarily a good thing. But what I hear about and what I see happening is people having the historical context of life in America complicating even the illnesses we have. This is what I mean by that. We've seen throughout this pandemic that people of color has fared poorer when you have the infection. We tend to get sicker. We tend to die in higher proportions. And a lot of what causes this particular illness to make us sick is our body's response to the infection. we tend to kind of over respond to it. And there's a lot of inflammation created in key organs, in blood vessels, in lungs. And so that extra inflammation that happens is really a response of our own immune system working. It's not that it's not working, it's working overtime. Life in America has caused us to have that aggressive response to insults for hundreds of years. We're kind of always on edge. It's easy to have our bodies start responding. Just look at high blood pressure rates amongst Black folk. That's, I think, a result of our bodies responding aggressively to the threats that's been around us all the while. But this was a chance to take some of those threats and minimize them. This was a chance to have those threats diminished and not increased. And we really didn't take advantage of that opportunity because some of the way our bodies have learned to respond, we can't change through meditation right now. We have to change through real things happening. And I'm not saying not being mindful is important, but some of these things are kind of in our DNA now. And we have to take advantage of other ways of recognizing that and changing that for ourselves. And I thought we kind of missed that opportunity. Plus, by having the virus circulate longer and longer in our communities, it gives it a chance to change more. And with Omicron, with that particular strain, with that particular variant, we kind of got lucky. It's one that infects a lot of people, but it doesn't make people as sick. That wasn't true with Delta and some of the other variants. And we don't know what's coming down the pipe. The longer this virus circulates, the more it changes. It might kind of change its way into just being something mild, or it might just kind of change its way into being something that makes us real sick all the time. We don't have to have that uncertainty. There's something that we can do about it to protect ourselves.
And even when you talk about mild illness, right? Who wants to get sick, right? no matter whatever it is you're talking about, no matter what issue you're referring to, who wants to get sick whatsoever? And then number two for me is, why take the chance? Why even risk it? Why even risk that? Okay, it could be mild for me, but then there is this potential opportunity that it might not be, and it might be something even more serious, right?
Right.
Yeah.
I think that's the approach we take, and for so long we've been willing to take that risk, and we feel like we come out okay, but we really don't. Not taking that high blood pressure medicine because you don't feel bad or you don't like the side effects, that's caused more Black men to have strokes. Not following up on your diabetes because it's not causing you a problem now. That's cost people limbs. They've lost limbs because of that, because of the vascular disease that happens. I think that we've put off stuff far too often and far too long in our communities, and we've waited and waited and waited, and the outcome hasn't always been good. And this was an opportunity to be a little more assertive at doing something that was more preventative, and we didn't respond as quickly as I would have hoped for us to. That doesn't mean that we're not responding. I got people still getting vaccines every day. I finally have the vaccines at my office, and we are immunizing people as often as we can, and it's not too late. I don't think that because I said we let that opportunity pass, it's really not gone. We can still get vaccinated, and I think it'll still make a difference, because I personally don't think that coronavirus is going away as a significant illness in our world.
And you addressed a lot in your previous responses, because the next question was going to be about why COVID-19 is different and from anything else the Black community has faced, and you touched on it. I think you touched on a lot of points, and just a couple things come to mind for me, right? is the fact that COVID-19 does not and has not discriminated against anyone. No matter the color of your skin or what you identify as, getting infected will always be a point of concern. The difference, though, is that, as you've mentioned, when you look across communities and you recognize the difference in living standards that some enjoy and others have to deal with, the realization is that not every household, neighborhood, zip code, or community is well equipped to come out of severe illness, to take the time off they need, or to find the ways to stay sane in this crisis environment. I said it before and I'll say it again. Yes, we are all going through the same pandemic, but it is absolutely not being experienced in the same way. Same storms, different homes, same tides, different boats. And then there's the crisis response, which has really been, I think, one of the most modern examples of I guess, universal healthcare, where you have free testing, free vaccination, and so many services being brought to the people, being brought to some of these priority zip codes, and even racism being declared as a public health crisis, something that we already knew, but is now on paper as a priority. When I see such shifts occurring, I'm right with you, Dr. Patterson, and our Black folks not taking full advantage of it when, and when I say ours, I'm talking about, even my parents, I'm talking about people close to home for me as well. And not seeing those people that are so near and dear to me, not taking full advantage of these resources when so many other communities are. It does scare me a little bit, but because who knows when we'll see this much potential and resource distribution to public health again, especially if we're not seeing the full impact. And if just to end those points, I'm just thinking to myself, we're as a county, we are approaching 50% vaccination rate among our Black and African American folks. There is no way that 50% of our kinfolk here in Montgomery County are wrong, right? There is no way that these folks who have taken that step are know something that is inaccurate, or that we don't. It's the science. It's something that we've been pushing for a while, and it can't be that every one of that bunch has no idea what they're doing. There's got to be something about that, something about half of a community standing up and taking that step that means something.
Yeah, I mean, I agree with that. I think that we sometimes put our faith and our trust in just in ourselves, and we have to look at more broadly the community and who all is doing it. When you spoke about 50% of Black folk having had the vaccine, when one of the disappointing things that's been true for me amongst the pandemic is what's happened with healthcare providers and their hesitancy to get the vaccine, especially amongst nurses and other ancillary care providers. But 95% of the doctors got it. We weren't really waiting on mandates. We wasn't waiting on those things. We went on and got the vaccine, and to use the logic that healthcare has been detrimental to Black folks, and that it is always targeting Black folks. If that was really true, why would all the doctors get the vaccine? Why would we do something that we know is going to hurt somebody? If we really believe that the impetus behind this vaccine was hurting people, that doesn't make sense to me. So we have to like you said, look at the fact that we all have a right to our opinions, but we don't have a right to our own set of facts. And the facts are that this particular virus worldwide, when compared to even the flu pandemic of 1918, ultimately it may show that in the United States more people died from that than has died from this. But think about how different healthcare is now from then. If we had the healthcare delivery of 1918 now, you could multiply that 800,000 plus people by about 10, at least. Wow. And that's how many people would have died, because I would argue that our healthcare system is about 10 times better than it used to be. People like Charles Drew and Daniel Hale made sure of that since 1918. They didn't know anything about giving blood transfusions in 1918. They didn't do cardiac surgery back in 1918. They didn't have ventilators that worked back in 1918 like they do now. This is sometimes seen as something that's not as severe, but part of the reason it's not as severe is because of what modern healthcare delivery has been able to afford us to have access to, albeit that access is not always distributed with equity.
Yes, and I think the way you summed it up, it shows that we have the opportunity to decide who we put our trust in. You mentioned medical professionals and doctors. 95% have gotten the vaccine. So you put your trust into the expertise, or you could put your trust into your own, and you recognize that half of our community has gotten that shot, will get that shot, and has gotten their second dose and their booster. So is it that web page, or is it some article you read, or is it what's right already here in your community? So that's the challenge, I guess, for folks who are still on that fence and still trying to figure out where to take it from here. But Dr. Patterson, is there anything you feel like is missing in our approach that we haven't pursued yet? What do you think our folks are waiting on to take that step, or what else needs to be done? What needs to be thrown into the mix to really see some more of a shift? And that may not be one thing, and that may be a very broad question, but what comes to mind when you think about, okay, this is what else we could be doing to whether it's the stakeholders or whether it's as a community to really make some progress in making sure that our Black folks are right there as we kind of pull ourselves out of this crisis environment?
It's hard for me to say just what else we need to do, but one thing I think that we need to do, Fabrice, is that we need to share more than just websites and videos. We need to share with each other our thoughts and our fears. We need to share with our healthcare providers insights into our decision making, and we need to do that with people that we trust. I think that when I get an opportunity to talk about the vaccine, I can address people's fears better one-on-one than I can doing a panel discussion on Facebook. And believe me, as you well know, I did a few of those along the way. And I think that it may not always translate into them leaving with a vaccine that day, but I think we need to do more to diminish some of the fear and not overread some of the language around the vaccine and the disease itself. I think that a lot of folks fear that we're just trying to make everyone fearful. I had someone point out to me, why are we calling the different variations of this virus variants? And they said that, that has a negative connotation. We're just trying to scare people. And, I'm thinking to myself, to me, it doesn't have that negative connotation, but to some people it may. He said, well, we used to only call things strains. Now we call them variants. That makes it seem devious, deceptive. And I think that that's some of where we are trying to reinforce our own views and not really trying to hear the complete picture to make a good decision with. There's no doubt that not everyone is going to get this vaccine, and I'm okay with that. But what I don't want to see happen is for people who have decided that their calling was to teach our children, and they also happen to be living with breast cancer, being at risk for your child to take something to them that can kill them. They don't deserve that. They shouldn't have that risk for something that we can prevent, and be that chickenpox or be that coronavirus. I think that we shouldn't have that fear of college kids, hanging out and doing things with their friends, but then they go visit their grandmother and their grandmother gets sick and die. We don't have to have that happen. And believe me, that story has happened more than once in our community. And that's a tragedy that I think we can prevent. And so I think we need to share our concerns and share these thoughts with not just coronavirus, but I talk about safely storing weapons in the home because our community has had a 3-year-old get a hold of a gun and shoot themselves. And I tell my parents to talk to your cousins about it, talk to your uncles about it, talk to we need to have that conversation with each other, not showing videos and pointing to what somebody said halfway around the world, but really being honest about the fact that, these are things that are fearful, but we can all get through these things together if we support each other in the decision-making process.
And that's a impactful point is, and this is a part of what this podcast is trying to do, right? Is to, yes, we know that the information and the facts are already out there and have been pushed out so many times, but it is time to start sharing experiences. And it is time to start connecting with hearts and minds. I mean, I can tell you right now, when the vaccines were made available, I felt so privileged to be able to, get mine and get my shot. And, I've even had to get on the phone with my mother and let her know, who was, also somebody who was reading into misinformation and reading into what was on Facebook or other apps that wasn't accurate, and say, I am not ready to lose you. And that's that. I am not ready to lose you. So I need you to really trust what I'm saying to you. And make sure that you do what you can to make sure myself and my 3 little brothers aren't, going through any type of loss on that end anytime soon. So yes, I would agree with you, sir. Sharing some experiences, really seeing if we can kind of nudge folks in that direction with what we've gone through and with what other people have gone through as well, because we are talking about hundreds of thousands who have passed in this nation, due to COVID-19, and we are seeing the hospitalizations continue to be predominantly those who at least the serious hospitalizations continue to be predominantly those who are not vaccinated. So, though I don't think those numbers lie. So, Dr. Patterson, I want to thank you again for joining us. Is there a message that you want to leave our Black brothers, sisters, and folks with before we end out? I know you've already said a lot. You've provided a lot of nuggets. So is there anything else that you feel like needs to be said and shared before we end out this podcast session?
Just that, I understand that vaccine is not the end all, and that there's a lot of other things that we need to continue to do. I think that we need to continue to have good hand hygiene. I think we need to continue to, at least for the near future, mask up and protect each other in that regard. I think we need to kind of limit our gatherings. And we need to pay attention to how these things change. I think we a lot of times want an absolute in life, and this is one of those things we're not going to have an absolute that this is the rule, that's how we're going to approach COVID, and that's going to hold true for the rest of the time that we're dealing with COVID. Some of these things are going to change. Don't see that as people not knowing what they talk about. Don't see that as people not having an idea of what they're dealing with. Have that understanding that this is what happens in science, and this is what happens in life. Things change. What we knew to be true yesterday might be different 2 weeks from now. And that's not because we didn't have it right 2 weeks ago. It might be that we had the best decision and the best answer on what we knew then, and now there's different set of circumstances. That's true. Don't take that to feed into the, they don't know what they're talking about and what they're doing narrative. I think that we've always done that in life. We've always found ways to adapt to changing times. And especially in the Black community, we've done a pretty damn good job of it. This is the same way on a broader scale. There's going to be some changes. There's going to be some things that are different, and we have to adapt and change. One thing that's still out there to take good advantage of is vaccination. It's something that I think will help save lives. I tell folks all the time, I didn't really get vaccinated to keep from just just to keep from getting infected. I got vaccinated to keep from dying, because I know I'm going to come across it. I know I'm going to see it. It's going to come in my office, and it might come in a way that I don't recognize. And it's something that I needed to protect myself from, because you know, I've been through some challenges myself, and I'm getting more gray hairs up on top of this head, but I ain't trying to go nowhere. I ain't trying to leave here. In order to do that, I have to have people around me protected. I have to protect myself, and we have to protect each other.
Thank you, Dr. Patterson, of course, for joining this session, but for also, you know, doing what you can to remain a resource to this community that so many look up to, and that so many, you know, really see as just a reliable influencer, somebody that is really looking out for, you know, the Black community. So thank you again.